If you're having problems urinating, that means you're getting up at nighttime to urinate several times, your stream is slow, you have difficulty starting and stopping the stream, maybe you're having some dribbling or some urinary frequency, and those complaints are bothering you, what can you do? Well, the first thing to offer you is medical therapy. That means taking medication before considering some type of surgical procedure. Now, we have different types of medications that are available. One medication, it's called an alpha blocker, actually relieves the smooth muscles or relaxes the smooth muscle cells that are located in the prostate gland. And by doing that, it makes the urine flow more easily. The symptoms go down. So many men are greatly improved by taking this medication. It's taken once a day. A second medication is a medication called a 5-alpha reductase inhibitor. It works by reducing the size of the prostate, and it can have long-term benefits by lowering the chance of needing surgery sometime in the future. Now, which one should you have first and which one works best? Well, it appears that the alpha blocker works faster. Many men will get some symptomatic improvement within a few days or a week of starting that medication. The side effects mostly include some lightheadedness in some men. Some men may have a drop in their blood pressure, although it's not something to avoid if you have blood pressure problems. And overall, it's very well tolerated. One other side effect is some men complain of retrograde ejaculation. That means that when they have an orgasm, the sperm or the semen doesn't come out, it goes into the bladder and then is removed after a man urinates. But overall, most men don't have those problems. The majority certainly, maybe about 5 to 10% complain of some of these side effects. And the side effects will go away if you stop the medication. Now, the second medication, the 5-alpha reductase inhibitor, can have some sexual side effects. About 3 or 4% of the men may have problems with erections. Some men complain of losing their sex drive. And here too, these side effects go away if the medication is stopped. So what is the general approach? Well, for a man who has these symptoms and wants to try medical therapy, the first thing is to start on an alpha blocker and give that a chance to see if the patient is improved. And then in some cases, we will also add the second medication, the 5-alpha reductase inhibitor, that will shrink the prostate. So some men actually benefit by having both drugs rather than just one. It depends partly on the size. Those men that have a prostate that measures greater than 25 or 30 grams are most suited for the drug that will shrink the prostate. Oftentimes, men can go on both drugs, and after a period of time, say 3 months, they can try stopping the alpha blocker to see if they're doing well enough by just taking the other medication by itself. And that way, many men are able to stay on one medication long term. Now, of course, the drugs only work while you take them. So for those men who get tired of taking pills year after year, then it may be worth considering some type of surgical intervention. But the good news is that medical therapy works, it can improve symptoms, and if you're having a problem, these drugs are worth trying.